All right, so first thing, okay, we're going to be looking at your skeletal tissue. So skeletal tissue, remember, we actually did this on the first lecture, okay? So we cut them, do a coronal section. The proximal portion is called proximal epiphysis. This is distal epiphysis, and this is diaphysis. Compact bone is located at the diaphysis, and then spongy bone is located at the epiphysis, okay? And the cavity inside the diaphysis is called the medullary cavity. It has yellow bone marrow. So those are the fats. And then this is what a skeletal tissue of the compact bone looks like. Each circle is called an osteon. Each circle is called an osteon. The holes that you see in the middle, those are called central canals. Blood vessel passes through there. And this is how it looks like on tissues, okay? See, there's actually a little bit of holes also to the side. Those holes are lacuna. They run through the lamellae. So the circles within the osteon is called lamellae. And if you notice, the lacuna has cracks. These cracks are called canaliculi. So these are what you see on the slide. Moving on, this again is what you see here, and this is a section located here at the compact bone. So these are the structures that you see in the area of the compact bone. And this is actually would be your lacuna with the cells inside the lacuna is a living cell. Inside the lacuna is called osteocyte. It's called an osteocyte. So if you want to take a look at the labeling, go forward and it'll actually tell you the answers on this slide. And this is what it looks like on the bone. Each circle is an osteon, okay, and you have a lot of these holes called lacuna, and osteocyte is inside the lacuna. This is the top view, and lacuna with osteocyte, it has cracks called canaliculi. So those are the basic structures. This is compact bone. So this is the lining of the cavity called the medullary cavity called endosteum. So this is where the medullary cavity is in the compact bone. And remember, this is filled with fats called bone marrow. Same pictures that we actually see, but this is one osteon. So this is a model representing one osteon. Again, this is one osteon, and the structures that we identified are the same. Again, another picture. I put a lot of this so it makes it easy for you to remember. So remember, the osteon is that big circle. The lamellae are actually the small circles within that osteon called lamellae. Then those are the blood vessels that enter into the central canal, okay? And that's actually your skeletal tissue, okay? Now, we're going to move into the skeletal bone. So remember, we did the skull, and then we did the vertebral column, and then we did the thoracic cage. We did sternum and ribs. Now, the skull, this is a sample of the skull that we actually have in lab. So the basic structure is identify on the anterior view your cranial bones, F-pod, S-E. Frontal, parietal is to the side here, occipital is to the back, temporal is to the side here, and then sphenoid, this part, posterior wall is sphenoid, posterior wall of the orbit is sphenoid, and the ethmoid is actually somewhere inside the roof of the nasal cavity. So those are your basic cranial bones. Now, the facial bones that you see here, this is actually the facial bone. L, lacrimal bone here. M, maxilla holds the upper teeth. N, nasal bone. Z, zygomatic bone. And then P, palatine bone, is going to be at the roof of the mouth. So LM and ZP are facial bones. LM and ZP. Now we're looking at holes. Remember, the hole that you see on top, that's called supraorbital foramen, or what we call a notch. Then the hole at the bottom, which is this one, infraorbital foramen. And then we have the hole inside here called of the orbital cavity. You have a crack on top. We call it superior orbital fissure. We have the crack on the bottom. That should be the inferior orbital fissure. And then we have a round cave. It's not actually seen because of this angle. That should be the optic canal. And then there's a hole here at the front of the mandible to the anterior lateral side. That is called the mental foramen. To the side view, remember, I'm gonna have you should be able to see the F-pot SE. So frontal parietal, occipital here, temporal here, and then that's your FPOT. S is going to be sphenoid. Remember, part of this wing is part of the sphenoid. Then ethmoid is inside this cavity. That's going to be an ethmoid. Now, if you notice, the temporal bone has this part here that's sharp. That's called the styloid process. Then the part here that's round, that is called the mastoid process. So basically, these are the ones that we will look at on the skull. Here is going to be the same thing, but I want you to concentrate on the suture. The basic sutures are only four. The one that separates the frontal and parietal, coronal suture. The one that separates the temporal and the parietal, squamous suture. And the one that separates the occipital and the parietal, lambdoid suture. And there are minor sutures that you see, parietal, mastoid, okay, but you just know the four basic sutures. The hole that you see here, the temporal bone, that's your ear canal, external acoustic meatus. Now, if I look at the back of the skull, I see sutures here that separates the two parietals. And that suture is called the sagittal suture. So that finish up our sutures. But you can see the lambdoid here also. Okay, and then we have this part here, the top portion. You can see the coronal, the sagittal, and then this is lambdoid. And it looks like a letter I, Roman I, and then you have the squamous here to the side. So these are the sutures from the top view. We're looking at the inside. The basic structure I just want you to look at is the sphenoid inside. This is the sphenoid. And the ethmoid at the front. So remember, the sharp portion, the ethmoid, is called the crista galli. The side where those holes are of the ethmoid, that's called your cribriform plate. And these are the wings of the sphenoid. You got greater and lesser wing. And the structure where it looks like a saddle in the middle is called the sella turcica. So those are the basic structures that we just need to know. Okay, so none of this we actually did we are actually using the holes from the opposite portion, which is the base. I'm looking at some of the holes called foramen ovale, which is actually, we're going to be using the bottom portion of the skull, which is this one. We're looking at some of the structures, and I'd try to move on to the forward one, okay, because we have the holes. Remember, this point here, you should be able to identify the holes from the base of the skull. The first one is lacerated looking hole, L, lacerum. Then oval shaped hole, O, ovale. Then the next one is a small hole called spinosum. That is going to be S. So you got LOS. Now go to the posterior. You have the carotid canal, circular hole, and then you have the hole that looks like a bean. That is your jugular foramen. Carotid canal is carotid artery. The jugular foramen is jugular vein. Stylomastoid is not visible in this. It'll be between the styloid process and the mastoid process. Okay, stylomastoid. Okay, and then after the stylomastoid, you have this hole called the foramen magnum. So again, anterior and posterior, teeth anterior. Okay, we're looking at the inferior of the base. And remember, the palatine bone is the only bone that you see here. That's the palatine. This is still part of the maxilla. Okay, moving on. Okay, sagittal suture. So that means this is parietals. Glabella is literally the part where the eyebrow meets. Okay, that's one of the strongest part of your skull. This is occipital bone, and remember, these are the wheels underneath the occipital bone. That is called the occipital condyle. Those are the condyles that will rock the bottom of the atlas to say yes. So this is temporal bone. I'm not going to go through individual structures of the cranial bones or differential bone. This is what a sphenoid looks like. So remember, the legs are called pterygoid process. And you got the lesser wing on top, greater wing at the bottom. But I want to take a look at the top portion of the sphenoid. This seat is called the saddle, and that's where the pituitary gland sits. That is called the sella turcica. So the sella turcica is that structure on top of the sphenoid where the pituitary gland sits. This is what an ethmoid looks like. And remember, the most important structure here is this sharp structure that protrudes upward. That's called the crista galli. And then you have this plate of the cribriform. Okay, and that is where those holes are located at. Okay, these are the cribriform foramina. And then here's going to be the mandible. And what do I have with the mandible? Basically, I have the mandibular condyle, and the sharp portion here is called the coronoid process. And this is called the mandibular angle, the corner here. All right, okay, looking at from another view, okay, condyle is round, mandibular condyle. The coronoid process is sharp. Coronoid process is sharp, and it got a notch. That's called your mandibular notch. And two holes that you want to identify here, okay? So the first hole is the one in the inside called the mandibular foramen, and the one outside is called the mental foramen. Again, mandible with the mandibular foramen seen. Okay, this is maxilla, holds the upper teeth. Not as actually complicated. Okay, again, this is an area where the frontal bone is. Then this is going to be the area of the maxilla, and this is the maxillary sinus, the cavity within that bone. This is what it looks like for the palatine bones. They're not actually palatine like a roof that is actually stiff, but there's actually are structures that has plates and processes. So we're looking at the inside of the skull. Just remember the sella turcica on top of the sphenoid. Okay, and this is the orbit. Okay, the back wall of the orbit is the sphenoid. And this bone is called the hyoid. Okay, remember the hyoid, it has the greater horns and the lesser horns than the body. Remember, this does not articulate with any other bone. That's the reason why it's floating on top of your Adam's apple. That's your hyoid. Now we're looking at the vertebral column. Okay, so if you take a look at the vertebral column, you actually are looking at the different vertebrae. Okay, so this is what the vertebral column looks like. Okay, I'm gonna say the main thing here, you should be able to identify the different vertebrae. I'm going to show you 3 vertebrae, and you should be able to identify if this is cervical, thoracic, and your lumbar. So I'm going to start looking at this vertebrae. So this one is actually going to be your thoracic vertebrae. Remember, this spinous process is pointing downward. Okay, this is the superior part. Okay, and this is inferior. So it's right position. Spinous process pointing downward. It's sharp. So this is thoracic. So this is what a thoracic vertebrae is. Okay, so your transverse processes, no holes. This is called the arch. This is the pedicles. This is the lamina. So the whole structure is called the vertebral arch. So from here to here. That's called the vertebral arch, okay? This is the vertebral foramen, the whole. We're still at transverse thoracic vertebrae. And this is actually where the nerves will exit. Remember, the spinal cord is continuation of the brain inside. And you notice to the side is where the nerves exit. So they exit between the 2 vertebrae. There's a partial hole on this vertebrae and a partial hole on this vertebrae. So it makes up a whole, okay, called the inter, meaning between vertebral foramen. And that is where the spinal nerve passes through. This one is, this is cervical because I have holes on the transverse foramen, and the spinous process bifid. Okay, this is cervical, and the holes of the transverse foramen is called the transverse foramina. So still cervical, but transverse process have a hole. Okay, now these are basic cervical vertebrae. Okay, this will be atlas. No spinous process in the atlas, only a tubercle. And then after that, you have this masses. It doesn't have this part here that is called the body. Okay, so this is going to be your atlas. Now, atlas and then axis. The axis is this thing that protrudes upward. That's called the dens, what we call the dontoid process. Okay, and this is atlas. Okay, remember, no centrum, no body. Okay, here's axis. You have this thing that protrudes upward. Okay. What is highlighted is the dens. So this gives you a rough picture and a lot of the labeling here. Okay. Again, so this is still cervical because I see the holes of the transverse foramina. And this is actually going to be what it looks like for thoracic. Pointed, sharp, pointed, slender spinous process pointing downward. Okay, typical thoracic, pointed downward, spinous process. Again, spinous process pointing downward. These are facets for the vertebrae to communicate. So this is spinous process, transverse process, centrum, vertebral foramen, pedicle, lamina, and that is pedicle, lamina, and then vertebral arch. So this is your vertebral arch. Okay, this is your thoracic, pointed spinous process, thoracic, pointed. This is the 12th thoracic, but if you notice, the 12th thoracic quite similar to the lumbar vertebrae. So that is because, remember, it's actually changing into a robust structure close to the lumbar, but it still maintains its lumbar characteristic, the thoracic characteristic, because that's where the ribs articulate. Lumbar vertebrae here, spinous process, transverse process. Okay, this is lumbar. This is sacral. And this is called your medial sacral crest, lateral sacral crest. Okay, and then alae, wings. Then this bump here that protrudes inward is called the sacral promontory. Okay, so this shows you about this bone called coccyx, but the joint between the sacrum and the iliac is called the sacral-iliac joint. There should be not much movement over there, okay? So it's not going to be moving in that area. So this is your trunk. Ribs connect to the sternum through cartilages, and that cartilage is called your costal cartilage. All right, so this is the costal margin running down here to the side. And remember, the muscle here is called the diaphragm muscle. Diaphragm muscle is dome-shaped, okay? So it follows this margin. Ribs 1 to 7 is true, 8 to 12 is false, but specifically 11 to 12 is floating. And this is what a rib looks like. It has a head. This is the neck where tubercles are. And this is the coastal cartilage where the ribs connect into the sternum. So all those green stuff is actually your coastal cartilage. Through ribs, ribs 1 to 7, false ribs 8 to 12, but remember, false ribs is 8 to 12, but 11 to 12 is specifically your floating ribs. It's still a false rib. Okay, this is what a sternum looks like. This is your sternum. This is the manubrium of the sternum, the body of the sternum, the xiphoid process of the sternum,